Picture this. You're playing with your dog, everything seems fine, and then bam, suddenly they're holding up a leg, not putting any weight on it at all.
Yeah, or maybe your cat, usually so graceful, suddenly has uh, this really odd gait, almost dragging a limb.
Exactly. Today we're doing a deep dive into something pretty common for our pets, joint luxations.
That's right. We're going to unpack what happens when those crucial parts that allow movement, the joints, get dislocated. Basically, how and why these connections come apart in dogs and cats.
And we're using a great resource you shared as our guide, Canine and Feline Joint Luxations. We'll pull out the key insights, the really important stuff you need to know.
Yeah, the goal today is pretty straightforward. Understand the causes, spot the signs, and figure out what's actually happening inside that joint when it luxates. We'll break it down nice and clear.
Okay, so let's start with the basics. What keeps a joint stable in the first place? What holds it together?
Well, think of the joint being wrapped in this strong, flexible sleeve that's the joint capsule. It's really the primary stabilizer, keeping the bone ends connected.
Like a container.
Sort of, yeah.
All right.
And then reinforcing that capsule, you have ligaments. Think of them like heavy-duty straps, adding extra support, especially against movements the joint isn't supposed to make.
Okay, capsule and ligaments. Makes sense.
But that's not all. The muscles and their tendons around the joint are also super important. When they contract together, we call it co-contraction. They really clamp down and stabilize things dynamically.
Trinamically? How so?
Imagine like two people pulling ropes on either side,
Yeah.
constantly adjusting to keep it steady. So instability happens when any part of this system, capsule, ligaments, muscles, tendons, gets damaged, or maybe it just didn't develop right from the start.
Right. So a luxation isn't just a little bit loose then?
No, definitely not. A luxation is a complete separation of the joint surfaces. They're totally out of alignment. Now, you also hear about subluxation. That's a partial dislocation. Still unstable, but the surfaces haven't completely separated. And it's key to distinguish this kind of obvious instability, the kind you can often see or feel, from just the normal, healthy flexibility a joint should have.
Gotcha. So what kind of things cause a joint to actually, fully dislocate?
Most often, it's trauma. Some kind of significant force, a bad fall, getting hit, a really awkward twist that pushes the joint way beyond its normal limits.
Ouch. Sounds painful.
Oh, it definitely is. And it's not just the initial pop. That damage to the capsule and ligaments can cause ongoing problems, leading to early arthritis and chronic joint issues down the road.
But you mentioned it's not always trauma.
Right. Sometimes if a joint is already unstable because of the developmental issue, something the pet was born with, it might luxate with much less force, even just during, say, normal activity.
So when this happens, what parts of the body are we really talking about being affected?
Primarily, it's the musculoskeletal system. So the inside of the joint itself, the cartilage, the joint fluid, and then all those supporting players. The capsule, the ligaments, the muscles, and tendons surrounding it.
And you mentioned the nervous system playing a role too.
Yes, that's an interesting angle. The nerves are involved too. You have nerves sending feedback from the joint about its position, and nerves controlling the muscles around the joint. Damage can disrupt that communication.
So the body might not sense the instability or react quickly enough.
Exactly. It messes with the whole feedback loop that normally helps keep things stable and coordinated.
Fascinating. Okay, let's talk about another big factor, genetics. How much does heredity play into this?
Oh, genetics can be huge.
Mm.
There are definitely inherited conditions that make pets more prone to luxations. Probably the most famous one is hip dysplasia.
Right, you hear about that a lot, especially in certain breeds.
Absolutely. It's essentially inherited looseness or laxity in the hip joint, but it's not the only one. We also see inherited shoulder luxation, especially in some small breeds like miniature poodles. Okay. And then there's femoral patellar instability. That's what leads to medial patellar luxation, the kneecap slipping out of place, usually towards the inside of the leg. Super common, particularly in smaller dogs.
So the kneecap just slides out of its groove.
Pretty much, yeah. And there's even a condition called Ehlers-Danlos syndrome, which is a broader genetic issue with collagen, the stuff that makes tissue strong, that can cause joints all over the body to be too loose.
Wow, so genetics can really set the stage. How common are these problems overall? Are we talking rare occurrences or?
No, some forms are definitely not rare. Hip dysplasia and that medial patellar luxation we just mentioned, they're actually relatively common in the general pet population.
Okay, so who tends to get these? Are there clear patterns in terms of breed or age?
Yeah, there are definitely breed links. For hip dysplasia, while you can see signs on x-rays in almost any size dog, it's the larger breeds that tend to show the obvious lameness and pain more often.
But traumatic ones could happen to anyone.
Exactly. A bad accident doesn't care about breed. But for the congenital stuff, yeah, we see trends. There's shoulder luxation, more in miniature breeds like poodles. Kneecap luxation, way more common in small breeds.
What about knee injuries in general?
Stifle or knee luxations are serious. They often involve tearing not just the cruciate ligaments, like the ACL in people, but also the collateral ligaments on the sides. And spinal luxations, dislocations of the backbone, those are almost always due to major trauma.
And age. Does that matter?
Well, trauma can happen at any age, obviously. But the congenital issues, the ones they're born with, we usually start seeing signs when they're young, like juvenile dogs. The catch is that early instability often leads to arthritis later in life.
And male versus female.
Doesn't seem to be a strong link there. No significant sex predisposition overall for joint luxations.
Okay, so let's say you suspect this might be happening with your pet. What are the telltale signs? What should you look for?
The most obvious thing is seeing the bones just not sitting right. An abnormal position. Like with a hip luxation, the top of the thigh bone often pops out upwards and towards the tail. Craniodorsal is the term.
So you might actually see a bulge or the leg looking shorter.
You might, yeah. Or the whole leg is held funny. Shoulder luxations often go medial towards the body's midline. Elbows tend to pop out sideways and slightly up proximal-lateral.
What about lower down, like the wrist or ankle?
With the carpus, the wrist, or the tarsus, the ankle, you might see the limb bending in an odd way, like bow-legged or knock-kneed, or maybe it hyperextends, bending too far backwards under weight.
Those are pretty clear visual signs. What else might an owner notice? Pain, swelling?
Definitely. Acutely, right after it happens, you'll almost always see swelling around the joint. It'll likely be painful to touch. And the big one is non-use of the limb. They just won't put any weight on it.
But what if it's a subluxation only partially out?
Good question. If it's a subluxation or maybe a chronic luxation that pops in and out, they might still bear some weight, but usually with a very noticeable limp or hesitation.
Okay, we've covered the what and who. Let's just quickly circle back to the why. Remind us what physically causes that joint to separate.
Sure. So number one is that traumatic force pushing everything beyond its breaking point, stretching or tearing the capsule and ligaments, overwhelms the normal stability.
Right.
But number two, don't forget, is minimal stress on an already unstable joint.
Right.
If it didn't develop right congenitally, even normal forces can sometimes be enough to cause it to luxate because that inherent support just isn't there.
Makes sense. Are there specific risk factors that make a luxation more likely besides genetics?
Yes, definitely. Things like poor conformation, the way the pet is built.
Yeah.
If their legs aren't aligned quite right, it can put abnormal stress on certain joints.
Okay.
Fatigue is another one. Tired muscles don't support the joints as well. Also, any kind of neurologic problem that affects muscle coordination or sensation can contribute. And sadly, a big risk factor for trauma is, access to roads and moving vehicles.
Right, the trauma risk. Okay, so if an owner brings their pet in, suspecting a luxation, how do you figure out for sure what's going on?
Well, first we need to rule out other things. Is it a fracture? Is it some other joint disease like an infection or maybe an immune issue or just bad arthritis?
How do you do that?
Basic blood work and urinalysis are usually normal with just a luxation, unless there was major trauma involved that affected other organs. Sometimes we might do an arthrocentesis, take a tiny fluid sample from the joint to help rule out things like infection.
But seeing the bones is key, I imagine.
Absolutely critical.
Mm.
Radiographs, x-rays are essential. They let us actually see the misalignment, confirm that the bones aren't where they should be relative to each other.
You mentioned stress views sometimes.
Yeah, occasionally we'll take x-rays while gently stressing the joint, carefully pushing or pulling, to see how much instability is really there, especially if we suspect ligament damage.
And what about just feeling the joint, the physical exam?
Oh, super important. A careful hands-on exam, palpation, lets us feel for that abnormal looseness, that laxity, or sometimes we can literally feel the bone end popped out of place. We have specific tests for different joints, too.
Like the Ortolani test.
Exactly, for hip laxity.
Uh-huh.
Or the cranial jaw test for knee ligament tears. We also have ways to assess kneecap stability and check other joints for excessive movement. Feeling that displaced bone is often a dead giveaway for a luxation.
It's interesting to picture the physical displacement, what's happening deeper, like at the cellular level in the tissues.
With trauma, right away you get hemorrhage bleeding into the tissues, you get edema swelling from fluid buildup, and you see the actual physical disruption, the tearing and stretching of the ligaments and the joint capsule fibers.
And long term,
Long term, especially if it remains unstable or keeps happening, the body reacts with inflammation. You start seeing the classic changes of degenerative joint disease or arthritis. Cartilage breaks down, bone spurs might form, that kind of thing.
okay, that gives us a really clear picture. So moving on to treatment. What's the immediate plan when a pet comes in with a suspected luxation?
First things first, rest. Limit movement of that joint. Then reduce swelling, often with cold packs initially. Pain control is vital. And then we need to stabilize that joint somehow.
What if stabilization isn't really possible or the damage is too severe?
In some really tough cases, if restoring good function looks unlikely, the initial focus might shift more towards just managing pain, potentially as a bridge to a salvage procedure later, like an amputation.
What about at-home care right at the start?
If the joint is below the hip or shoulder, so like elbow, wrist, knee, ankle, we often use a bandage or splint to immobilize it. And yeah, those cold compresses, maybe 10, 15 minutes a few times a day for the first day or two, can really help with swelling.
And activity restriction, how strict does that need to be?
Very strict. We're talking cage rest usually until things are stable. No running, jumping, stairs. Then it's a very, very gradual, controlled return to activity over weeks, allowing those soft tissues to heal properly.
Does diet matter much here?
Not really for the healing itself, just a good quality diet. But what is crucial is managing weight. We have to stress to owners. Keeping the pet lean and avoiding excessive activity long-term really helps reduce the risk of arthritis getting worse later.
Okay. Now, surgery, when does that become the best option?
Well, sometimes we can try what's called a closed reduction. Under anesthesia, we physically manipulate the joint back into place without cutting.
Does that work often?
It can't work if the supporting structures are mostly intact and there aren't major underlying bone-shaped problems. But it's generally less successful or not recommended for joints like the hock, carpus, or stifle the ankle, wrist, or knee. Those often need more stability.
So if closed reduction doesn't work or isn't suitable,
Then it's open surgery. We surgically expose the joint, put it back in place, and then often perform some kind of stabilization procedure.
like what?
For a hip, maybe a toggle pin repair. For other joints, there are various techniques using screws, wires, or synthetic ligaments. The goal is to hold it reduced while things heal. After surgery, we usually need external support too.
Like a sling or splint.
Exactly. An Emmer sling for a hip, maybe a spica splint that goes up over the shoulder, or a hip for elbow or knee repairs. Helps protect the surgical repair during healing.
You mentioned earlier that these can pop out again, right?
Yeah.
Especially the congenital ones.
Yes, that's a really key point.
Right.
Reluxation is unfortunately a significant risk, especially if there's an underlying instability the pet was born with. It's frustrating, but it happens.
So what if it keeps happening or the joint is just too damaged or painful?
That's when we talk about salvage procedures. Options might include total joint replacement, like a hip replacement, or removing the femoral head and neck for hip issues in FHO, sometimes fusing the joint, arthrodesis, or as a last resort for severe, untreatable pain or dysfunction, amputation.
Let's switch to medications for a minute. What's typically used?
Pain management is key. The mainstays are usually NSAIDs, non-steroidal anti-inflammatory drugs, things like carprofen, meloxicam, daracoxib, firocoxib. They work by reducing inflammation and pain signals.
Any others?
Tramadol is sometimes used, often alongside an NSAID, for extra pain relief. It works a bit differently.
Are there pets who shouldn't get NSAIDs?
Oh, yes. We need to be careful. Pets with known stomach sensitivities or existing liver or kidney disease might not be good candidates. And owners must know to stop the meds and call us if they see any vomiting or diarrhea.
Any interactions to worry about?
Yeah, you don't want to combine different NSAIDs or use them with steroids typically. If NSAIDs aren't suitable, we look at other types of analgesics, other pain medications.
What about follow-up after treatment? What's needed?
Follow-up x-rays are crucial. We need one right after reduction to confirm it's truly back in place. Then usually another set after the splint or sling comes off, typically around 2 to 4 weeks later, to check that it's staying put.
Can owners do anything to actually prevent luxations?
Well, for the traumatic ones, it's about injury prevention, secure fences, leashes near roads, that kind of thing. For post-treatment, if a sling or splint is prescribed, keeping it on properly for the full recommended time is absolutely vital for healing. You can't prevent the congenital predisposition, unfortunately.
What are the main potential complications owners should be aware of?
The biggest one we've mentioned is relaxation. It's popping out again. After surgery, there's always a risk of infection or potentially failure of any implants used, like screws or pins breaking.
Okay, so wrapping this up, what's the typical outlook? Can pets get back to normal?
In many cases, yes, especially with traumatic luxations treated promptly and properly, we expect a good return to function, assuming no major complications. However, that high relaxation rate, especially with the congenital stuff, means the prognosis can be more guarded sometimes. And long-term progressive arthritis is definitely a common concern we need to manage.
Right. So, to sum up this deep dive, joint luxations, whether from accidents or underlying issues, are serious business for our pets. But understanding the cause, getting a prompt diagnosis, and following through with the right treatment plan, which might involve rest, stabilization, surgery, meds, gives them the best shot.
Exactly. And hopefully you listening now have a much better handle on what's going on when a joint luxates, why seeing the vet is so important, and the different ways we can help get your furry friend back on their paws.
Definitely. So here's a final thought to leave you with. Knowing that these issues can stem from both sudden trauma and potentially inherited weaknesses, how might a deeper awareness of your own pet's specific risks, think about their breed, their build, how active they are, change how you approach their care, their activities, maybe even their environment throughout their life? Something to consider.